So the Healthcare Reform Seminar Series, I think, is one of the things at the GSB that I'll be most proud of leaving. I think it came from a little bit of that leap of faith of, okay, I'm really interested in this topic, and people at the GSB are generally pretty curious about things, so let's see if this works. What was great about the series is there's a lot of resources that the Healthcare Club offers, and through the Program for Health Innovation, I was able to work with them to shape what a program would look like and able to leverage their contacts and resources to help make that happen.
So the Healthcare Reform Series was a new effort that the Healthcare Club and Program for Innovation put together this year, focused on kind of looking at U.S. healthcare reform from a number of different perspectives. So we had some really awesome guests that came in from the provider side, the innovator side, policy, funding, et cetera.
And what made these special was they were small, they were intimate, 30 students who signed up to attend. And it was not the lecture. I mean, it was really a seminar and an interactive dialogue between students and these people that were just at the forefront in different areas of the industry.
What was most interesting was to hear how the perspectives changed depending on who was kind of giving the talk. It was kind of nice to see it as more of an optimistic series, that this sector is changing a lot, but there's a huge amount of opportunity in terms of providing better care, higher quality, lower cost, more consumer-oriented care. Relative to kind of some of the rhetoric, which is healthcare reform being this huge change that's very overwhelming, it was very kind of focused on the opportunities that exist and the optimism around kind of what to invest in and what companies can do in the future.
So we had Bob Kocher, who provided an overview of the healthcare reform, kind of what we called Healthcare Reform 101. And he was kind of the healthcare advisor to President Obama during the entire development of healthcare reform in 2010. We also had then Robert Pearl from Kaiser Permanente, who was also a faculty at Stanford and was able to provide really the perspective of the providers and what they're facing as they go through healthcare reform. We had Steve Helmsley from the United Healthcare Group to provide a payer perspective. We also then had John Kapik from Abbott, who provided, again, what the private sector is looking at and what it looks like for them as they encounter these issues. Lastly, we had Senator Bill Frist, who had a former career in healthcare before coming into government and was able to provide a very unique perspective that was tailored to healthcare within the public sector.